Hello, my name is Davey Osborne, and this is the biomechanical analysis of the lacrosse overarm throw. The lacrosse overarm throw begins in an athletic base. The contralateral foot is forward to allow hip to shoulder separation. The trunk is rotated away from the target, preloading the trunk rotators through the elastic stretch. The shoulder is positioned in about 90 degrees of abduction and external rotation, placing the glenohumeral joint in a position to generate the maximum torque. The purpose of this setup is to allow efficient energy transfer from the ground up through the kinetic chain. Biomechanically, this improves torque production and maximizes angular velocity at the distal segment, which is the stick head. During windup, the athlete establishes rhythm and balance. Muscle activity is pretty low, but the stabilizers are active. In the early cocking involves trunk rotation towards the target and increased shoulder abduction. And then the second phase of cocking is characterized by maximal external rotation of the shoulder, usually reaching around 160 to 180 degrees in the trained throwers. And this is where the elasticity generates like that max force. Acceleration begins immediately after the maximal external rotation. Shoulder internal rotation angular velocities can exceed 7,000 degrees per second in overhead athletes. Elbow extension and wrist flexion sequentially add velocity. Follow through is one of the most critical aspects of the lacrosse overhead throw because the deceleration phase is so important for protecting against injury. The posterior shoulder muscles are really big in this aspect. They do a great job to eccentrically contract, and they dissipate that force and energy going through the glenohumeral joint. The glenohumeral joint, or the shoulder joint, sacrifices stability for that dynamic mobility. Static stabilizers include the labrum and capsule, but dynamic stabilization from the musculature is also essential. The pectoralis major produces a lot of that horizontal adduction by concentrically contracting and pulling that shoulder inside. And internal rotation, it's also responsible for internal rotation during acceleration. The latimus dorsi contributes to extension and also internal rotation. The rotator cuff is also important. It maintains humeral head centration. During late cocking, the infraspinatus and teres minor, they control excessive external rotation to protect the body. And then during the follow through, they help to decelerate internal forces. The elbow and wrist are the last two joints involved in the actual throw of the lacrosse overhead throw. And the triceps contraction during acceleration rapidly extends the elbow, which increases the velocity of the forearm. And the biceps acts eccentrically to protect against hyperextension and injuring that elbow. The wrist snap just before the release does increase the stick head velocity, but its more important function is to contribute to fine motor control and aim the shot rather than just add even more power on. Sequential activation is really critical because improper timing of sequences can completely disrupt and ruin the summation of the forces. There are multiple important functional anatomy terms that we can see in the lacrosse throw. The stretch shortening cycle enhances force production. During late cocking, those internal rotators are stretched out, storing elastic energy, and then really whipping that forward to produce more force. The length tension relationship explains why limited or excessive external rotation reduces the force. They have to have that optimal overlap of the actin and myosin fibers. The force velocity curve demonstrates that faster contractions produce less force, but training can increase force output at higher velocities. Active insufficiency can occur in a lacrosse shot if multi-joint muscles like the biceps are shortened across both of the shoulder and elbow, and that's going to limit your force output throughout the athletic movement. Passive insufficiency is also something that can affect it. It affects most of the posterior shoulder structures if your flexibility is not adequate. You have a certain amount of required range of motion that you want to see in lacrosse athletes. For external rotation at the shoulder, you want to look at around 160 to 180 degrees. And then internal rotation, you want less than 70. Elbow flexion is very important as well. You want to see around 90 to 120 degrees, which is going to prepare you for that rapid extension. Trunk rotation, about 40 to 60 degrees, as well as hip rotation of 30 to 45, which is really important because this motion is a proximal to distal motion, and it generates a lot of the power from that torque around the core twisting. So the lacrosse overhead shot is primarily seen as a transverse plane dominant movement because the majority of that velocity generation occurs during the twisting of that trunk and the hips. It is a angular velocity increases as movement progresses from proximal to distal out towards the hands and arms. And it sees a sequential action that you want to see performed in quick succession. Starts with that hip rotation, following is the trunk rotation, and a key aspect of this is that you want to see shoulder to hip displacement. Studies in baseball pitchers see that the more displacement you can see between those two, the more force you can generate with their throws, and that carries over to lacrosse as well. After that, you see shoulder internal rotation and then elbow extension finally getting that last snap on the ball. So when looking at the kinetics of the lacrosse shot, we can see that it is generally seen as more of a torque-focused athletic movement. It is a third-class lever, and then to look at the torque formula, that would be force times momentum arm. So the average athlete for lacrosse can be seen exerting about 300 newtons of force with that moment arm of 0.04 meters, which comes out to 12 Newton meters of power. So when looking at these force measurements, we see work, power, and then ball kinetic energy. So work represents the total mechanical energy transferred to the system. Power reflects more the explosiveness, which is critical in these overhead throwing motions. And then ball kinetic energy indicates how effectively the body has transferred their energy to the lacrosse stick and then through the lacrosse stick to the projectile. So efficiency can be reduced if energy leaks occur due to poor sequencing, mistakes in muscle activation, timing, and just general mistakes like that, yes. When looking at forces specifically in the acceleration phase, we can see that there's a lot of anterior rotational torque that is generated by those internal rotators. Gravity is in play, although it is not as important during the throwing motion because there's a lot more force being produced by the internal muscles of the lacrosse player. However, of course, gravity does have a major effect on the ball once it is released from the lacrosse net. Joint reaction forces increase significantly because compressive and shear forces may exceed several times the lacrosse player's body weight. Proper scapular positioning can reduce harmful shear stress. And then, of course, another small force is the inertia of the ball, which is not at largely in play due to the fact that, again, the player's muscles have a lot more force generated than the inertia of the ball. As with many contact sports, there are injury risks with lacrosse, and especially with this throwing motion. Shoulder and elbow injuries are very common due to the repetitiveness of this motion. Players perform it many times over the course of practice and games. One of the most reported shoulder injuries is the slap tear, which affects the superior labrum, where the biceps tendon attaches, because during late cocking, there's an extreme external rotation, generating a lot of anterior shear forces at the shoulder joint. The labrum can absorb excessive stress from this if the rotator cuff control is not sufficient. So rotator cuff tendinopathy is also common because of, again, the repetitive motions and the repetitive eccentric deceleration that the rotator cuff is forced to control. Um, there's also, for elbow injuries, a lot of UCL sprains because there is a lot of valgus stress during acceleration. Um, this is seen very similarly to the UCL strains that are seen in baseball as well. Medial epicondylitis or flexor pronator overuse can also occur because of the force exerted on the gripping and wrist snapping motions.